The definition of endocrine resistance has been developed by consensus, not randomized trials, and was first introduced in the 5th ESMO guidelines. But here, we will look at the updated definition of endocrine sensitivity and resistance from the recently completed ABC7 meetings in Lisbon. So here we go. Primary endocrine resistance is defined as relapse within the first 2 years of adjuvant endocrine therapy after early-stage breast cancer, or progression within the first 6 months of endocrine-based first-line therapy for MBC, irrespective of the use of a CDK4/6 inhibitor as part of the treatment. All other clinical situations of endocrine resistance define secondary endocrine resistance. Examples include relapse while on adjuvant endocrine therapy but after 2 years, progression after 6 months of first-line endocrine therapy for MBC, or progression after any duration of second-line endocrine-based therapy for MBC, or an ESR1 mutation. Recently, Lambertini and colleagues published a report in Lancet looking at the outcome of over 6,600 patients who had HR-positive, HER2-negative, early-stage breast cancer and were enrolled in 4 phase 3 randomized trials evaluating chemo, endocrine therapy, and duration of endocrine therapy. The median follow-up is 9 years, and about 10% had a distant recurrence. It's important to keep in mind that these studies were done from 1992 to 2012, so don't necessarily represent modern treatment. 493 had a distant recurrence as their first disease progression. Of those, about 15% had primary endocrine resistant disease by definition. 42% had secondary. Primary resistance was associated with younger patients and with a higher incidence of visceral mets, particularly liver. Overall survival based on endocrine sensitivity is markedly lower in patients with primary endocrine resistance at 27 months versus 38 and 43 months as you increase sensitivity to endocrine therapy. The most recent data with current treatment strategies was presented by Agostinetto at ASCO this year. Here, they looked at impact of endocrine sensitivity on progression-free survival in patients treated with first-line CDK4/6 inhibitor therapy using the Aurora molecular screening initiative. 339 patients were evaluated. For patients with primary endocrine resistance, the median progression-free survival is just 6.6 months, going to 14.6 months in secondary endocrine resistance and 26 months for endocrine-sensitive disease. So clearly, there is currently unmet need for new treatments for patients who have primary and secondary endocrine resistance, other than the doublet therapy of CDK4/6 inhibitor and endocrine